As we know, COVID-19 is an infectious disease that had not been detected in humans until now. This is why today we spoke with a public health professional to contextualize the community and to make known the key points of this new virus.
Cases have been identified on all continents, and on March 6, the first case was confirmed in Colombia. From that moment, all possible measures have been taken to avoid the spread of this virus. But what is the coronavirus and how dangerous is it?
The disease is called COVID-19 and the virus is called SARS-CoV-2. This virus causes a disease called SARS, which is a severe acute respiratory syndrome, which means that it causes a respiratory problem. Then those that are symptoms that we can transmit to other people. For example, we cough with our hand. This hand gets contaminated, we touch something, another person touches it and takes it to his face, and this can be a vehicle of contagion, so we go from person to person. It can also be from a frontal position, the person coughs and the virus reaches another person.
The public health professional also talked about the major risk factors and when we should be concerned if we have symptoms related to COVID-19.
When you have a history of traveling to a country where the virus is loose, for example, Italy, China, and Spain, are countries that have the virus walking. Currently, the 95 people who are infected are people who have the virus because they are imported from Spain or Italy, or their relatives or friends were infected, but at any time can generate a new stage of the pandemic that will be the mass dissemination. So currently, the recommendation is if I came from some country or had a relationship or some contact with a person who has come from one of those countries. Second, constant cough, strong and annoying, and the other is fever. You have to have a fever above 37.5 and sustain to really have a concern about having the virus.
Remember that the most effective measure to prevent COVID-19 is to wash your hands properly with soap and water. Doing so frequently reduces the risk of getting coronavirus by up to 50%.